It's National Stroke Awareness Month, and according to the experts, the numbers are shocking. Over 700,000 people have a stroke each year. That's one person every 40 seconds. Brent Deerking and Dr. Elwyn Crawford and Charles Stewart are all here from NorthStar EMS to tell us all about it. Guys, thank you so much for being with us today.
Thank you. Thank you.
Absolutely. Well, let's talk about strokes. Exactly what is a stroke?
There are two different types of strokes. There's an ischemic stroke and a hemorrhagic stroke. And an ischemic stroke is very similar to a, quote, heart attack of the brain, where you have one of the carotid, one of the arteries going into the brain, or carotid arteries, will actually clog because of cholesterol or et cetera, and decrease the blood flow to the brain. A hemorrhagic stroke is one that a blood vessel actually ruptures, and that as a result decreases the blood supply to that part of the brain.
Gotcha. Now, who's the most at risk?
Several people, African Americans, have almost twice the risk of Caucasian people. Also, women are more at risk, and that's simply because they live longer than men at this point in time. Also, those people with hypertension, high cholesterol, uncontrolled diabetes, obesity, alcohol, excess, smoking, those are all risk factors for strokes. Understood.
Now, how can we tell if someone has had a stroke, or if I don't know, what is commonly confused with, a lot of times, angina. People seem to think they've had a stroke. How can you tell if you've actually had one?
Right. With a stroke, what we're mainly looking for is a facial droop to one side or the other. Difficulty in raising an arm. I mean, if you ask them to raise both, one may drift a little bit. And slurred speech or difficulty speaking, and sometimes they try to speak, but they're not able to get the words that they want to come out. Those are the three main things that we're looking for.
There you are. Well, how do we keep this from happening? Can we prevent strokes?
Certainly. Increase your exercise, control your weight, control your diabetes, control your blood pressure. If you have atrial fibrillation, which is an irregular heartbeat, make sure that that is controlled. Make sure your cholesterol is controlled. All of those factors can certainly lower your risk of having a stroke.
There you go. All right. And Brent, next week is a pretty special week, and you've got something special you'd like to do here today on First at 4. Right?
I would, Danny, and next week is EMS week, and we just wanted to take a few moments on behalf of NorthStar EMS to really thank all those involved in the health community, especially our EMTs and paramedics, with the ambulance services and the fire departments, and those medical professionals working in the hospitals and nursing homes, because everybody really plays a role and a part in delivering health care to the community. One thing we wanted to do for you and WVUA TV is, it's been almost 8 months ago we entered into a partnership to really work on trying to communicate messages to the community about injury and illness prevention strategies. So we just wanted to take a moment and recognize WVUA TV on behalf of NorthStar EMS and thank you and the station for helping us achieve that goal. So just a little plaque of recognition.
Wow. Well, thank you.
And thank you very much.
Absolutely. I thought one of these guys was going to be getting this. It was like EMS or EMT of the month or something. That is very, very nice. Look at this, guys. We've been recognized for our hard work. Isn't that nice? Refreshing change of pace.
Absolutely. So thank you, Danny.
Well, thank you guys too. Absolutely, absolutely. All right. Unfortunately, we're out of time. I would love for you to, stay here with me and tell me how awesome I am some more, but
we'll do that next month.
We got to pay the bills, that's, as they say. All right, you can find out more about NorthStar EMS by calling 205-345-0911 or online at northstar-ems.us. I'm starting to sound like a broken record, but I really don't care because it is still absolutely gorgeous out there. I don't know what Richard Scott's doing, how he's doing it, if it involves chickens, their death, maybe being very sweet to the chickens instead. Whatever it is, it's working. Home Team Weather's coming up next when First at 4 continues.